So what are the post-MI complications? Post-MI complications may involve pericardium, conducting system, or the muscles. If it involves the pericardium, it may cause pericarditis or Dressler syndrome. This cardiac tamponade in the conducting system, it may cause arrhythmia, and in the muscles, it may cause congestive heart failure or cardiac rupture. And last and the least, it may cause infection and death. Here we are dealing with the rupture of the heart or the complications of post-MI cardiac ruptures. When does the post-myocardial rupture occur? Post-myocardial rupture occurs about 3 to 5 days after myocardial infarction. So remember, the rupture occurs 3 to 5 days after infarction, and acute pericarditis about 7 to 10 days after the infarction. And the rupture usually occurs with a small and first myocardial infarction. Where does the rupture occur mostly? It's in the left ventricle, right ventricle, or in the septum, or in the papillary muscles. So what are the complications of post-myocardial infarction with cardiac rupture? The complication of the post-myocardial infarction cardiac rupture are pericardial tamponade, VSD, acute mitral regurgitation, and a pseudoaneurysm. Most common etiology of the left ventricular pseudoaneurysm is an acute myocardial infarction. Pseudoaneurysm is twice as common with inferior MI than with anterior MI. So pseudoaneurysm is more common with inferior MI. So why does the mitral valve regurgitation occur as a complication of cardiac rupture? If there is a rupture of the papillary muscle, then it causes mitral valve or the tricuspid valve prolapse. So where is papillary muscles? Papillary muscles are two groups of 5 papillary muscles, an anterolateral muscle group and a posteromedial. Anterolateral group is supplied by left anterior descending branch and the left circumflex artery, obtuse marginal branch. And the posteromedial group is supplied by the right coronary artery. So which papillary muscle ruptures more? The posterior medial group ruptures more because it has a single blood supply of the right coronary artery. Papillary muscles are attached to the cusp via chordae. This is the papillary muscle, this is chordae, and this is the cusp. Papillary muscle via chordae is attached to the cusp. When the ventricle contracts, papillary muscle contracts and prevents prolapse of the valve into the atria. But if this muscle rupture as a result of myocardial infarction, the valve prolapses and causes mitral valve regurgitation. Papillary muscle rupture occur about 13 hours after MI. If anterolateral papillary muscle ruptures, then there is a new pansystolic murmur at the cardiac apex that radiates to axilla or to the base of the heart. If posteromedial papillary muscle ruptures, which is more common, murmur radiates to the left distal border and may be confused with murmur of VSD or aortic stenosis. Mitral regurgitation murmur radiates to axilla, best heard at apex with patient in left lateral position. Mitral valve prolapse produces a mid-systolic click. Diagnostic test of choice is two-dimensional echocardiography with color flow Doppler imaging. In severe mitral regurgitation, the mitral valve leaflet is usually flail.